I want to ask you about this because Dr. Fauci, he at one point had security,
Yeah.
went from being someone who was really focused clinically, policy wise, now being on TV and a whole bunch of sort of things, had to end up getting security and so forth. What is it like for you being, in your position, being on TV all the time, talking about things, contradicting, the leader of the free world at certain times and his administration at certain times? What is that like when the lights go off and it's just you and your husband and your kids?
Oh,
Is it nasty
I don't know.
emails? Is it phone calls? Like, what's that?
No, it's funny. I'm really lucky, and I think some of it's the privilege. I live. I'm a New Yorker. I'm a white woman.
Mhm.
I come from a community of relative affluence, and so most of the people I speak to are either like-minded or willing to listen to me.
Got you.
And so when I talk in my general orbit, even when I dig into Facebook groups or people that are not like-minded, I do it with a sense of authority that's generally not rebuffed, right? When I go on networks, if I go on MSNBC, I generally get positive feedback. If I go on Fox News, that's when you start to get the interesting drops into your DMs on Twitter or retweets calling you something. Sometimes I'll be on a very like a neutral platform like PBS or NPR, and I'll say something consistent with science but against the administration. And those are the times that I will get flamed even more than MSNBC because I think that the idea that science could be partisan or that can be perceived as partisan triggers a lot of people when it's absolutely not.
Mhm.
Um, and so I've been very lucky, unlike Uche Blackstock or Esther Chu, who are both women of color. Even my male friends who are black and brown uh, get destroyed and really get very not positive messages to their email. People find your personal email, they find your work email. Although sometimes Craig Spencer gets nasty emails,
Really?
and he's a white guy. Yeah, he
Okay.
does, right? You'd be
Okay.
surprised.
Mhm.
But he goes on Fox News a lot, and so he stands with science, and that can become, kind of it becomes very it feeds the trolls, if you will.
I'm they know what you're going to say though, like for example, like a Fox News or MSNBC, but for example, like a Fox News, like they know what you've said, like they've researched what you said. Why do you think they bring you on?
Mhm.
I'm always interested about that because they
So
know you.
they don't yeah, they don't bring me on as much anymore, and I
Okay.
think that we've had experiences where a lot of us have been, um we've been hired by networks as commentators, and there's a reason that none of us are commentators on Fox News. I don't think they want our opinion regularly. I think sometimes some anchors and producers will want to have a more balanced perspective, especially when things get really bad. But I don't think they want truth right now, when the truth is hard. I mean, this is a terrible time for America, but for all of us, and that doesn't you can't sugarcoat uh, that what's going on
Mhm.
so much that it seems like it's all great. Even the vaccine situation, the idea that we've generated a vaccine is amazing.
Right.
Um, but that's one piece of the puzzle, and we're not mission accomplished. And it wasn't, Operation Warp Speed was amazing in its investments and in its kind of regulatory kind of support slash like what it did to help industries like thrive in this moment. But nothing vaccines are not vaccinations.
Mhm.
And so we need to make sure that the delivery mechanism and the campaign and the understanding and the faith and the truth and the trust and all the things that have to happen now, it doesn't help us to have millions of doses of a mRNA in a lipid soluble bubble in a little jar
Mhm.
frozen at sub-zero temperatures if nobody was willing to take it.
Right. Well, that being said, COVID affected you, affected your family. COVID affected me, and so forth. What are your thoughts on taking the vaccination? Will you take it? Because I'm wondering what the situation is if you've already been infected. Like, is it like the chicken pox? Should you still take the vaccination? That's the one thing I'm
So,
interested in.
because part of the complication of doing all this research so fast is that it was done for the most benefit, I think, in the largest scale to answer the most questions with one study, right? And the main study was done. So there were people who had been exposed to the virus before in the study. And the study found, at least in the FDA data that was published yesterday, which we'll hear about more tomorrow, Thursday the 10th, whenever this comes out, because that's when the hearing is. There were patients who had were prevented from a reinfection by being vaccinated. So there were patients in the placebo group that had been infected in the past, got reinfected, and there were patients in the treatment group that did not get reinfected. So the reason why that's important is because the infection and the recovery is unknown, right? First of all, let's like lay out the landscape. This disease is it's a mystery, right? We don't even understand a lot of how and why it affects who it affects.
Mhm.
We don't know who it's going to kill. We don't know who it's going to put in the hospital. The pathophysiology is still complicated and it's very unpredictable. We've gotten better at managing it, but it's very much like taming a beast. It's not like we know how to, ride it through to the
Right.
end. So you're taking an unpredictable virus that's contagious and everywhere. So you're not in a position where it's a faraway virus, or it's not that contagious, or it's not respiratory, or the likelihood of getting it is low. It is a high likelihood, unpredictable virus that could kill you.
Mhm.
That is the baseline. So the vaccine is then compared against that, not against the idea that you can avoid it, not get it, and you're going to be fine no matter what. And so it's not the voluntarism, in my perspective, and I mean that as a person who's either going to get infected or get vaccinated. I will choose to get vaccinated because of the following reasons. The inoculation level is more predictable in vaccination than it is in natural infection. The immune response will be more predictable in vaccination
Right.
than in natural infection. The ability to track and to monitor people's loss of immunity will be easier after vaccination than natural infection. And nobody has died from vaccination versus natural infection. Now, because it doesn't infect you with the virus, it gives you a little piece of coding that like allows you to make one protein that triggers your immune response, that allows you to have memory to fight the virus when you see it. It's that simple. So it's a stealth secret mechanism to prepare your body to fight the virus itself. And that part, the fighting of the virus, seems to be working really, really well.
That's the part that I was really interested in, because I have antibodies. My wife has antibodies. Actually, my kids have antibodies. But when we talk to our pediatrician or anybody else, it's like, we don't know how long these antibodies are going to last. And it's really interesting that you mentioned with the vaccination, it'll be a little bit easier, or we think it'll be a little bit easier to track.
Right.
Mhm.
And the antibodies you have are not the same antibodies that are generated by the vaccine. And I think this is something people are going to be confused by. This is as far as I understand it, but I'm not a virologist and I'm not an immunologist. Uh, the antibodies we check on our little IgG cards and our finger sticks and all the machines is it's to a different protein than what the vaccine is triggering. And so it is possible to be vaccinated and to be effectively immunized and not see antibodies on the tests that we're using to track our natural infections. And so I don't know exactly uh, what that will look like. We may find that people after vaccination have antibodies to both the thing we have antibodies to by being infected, and then the vaccine vaccine spike protein, which is what you're inoculated against. So it's going to be very interesting to watch
Mhm.
how this all plays out. And there are very few answers and lots of questions. But first and foremost, I will get vaccinated. I will get vaccinated early, and I will be very public about it, because there has been no indication that it is unsafe to get vaccinated. And for me, that's the bar, because it is unsafe to get
Right.
infected.
Right. Got you. All right. That's a good point. Thanks for clarifying that. I'm interested. So what happens when how much time in advance do you know before you get put on TV?
Uh, Hopefully a couple of days.
Okay.
Sometimes it's an hour or two. But a lot of it'll be reacting to stuff I'm already reading about. Like, because a lot of us are paying attention to this all the time, we're pretty much, I kind of prepare regularly to say, oh, this is going to happen. I mean, the absolute worst day for that was the day that Donald Trump got COVID.
Yes.
Uh, that was because um, I went to bed at I don't remember what was happening. I think that there was all this conversation about him maybe having it, maybe not having it. And then he was isolating, and that was obviously out of character. So I went to bed at maybe midnight or 1 a.m., whatever it was. And my husband rolls over. He is going to the bathroom or something at 3 in the morning, and he pokes me, and I'm poking me, leave me alone. I'm sleeping. And he looks at me and he goes, Donald Trump has the vid. And the vid is what, Kevin Hart calls it
Right.
in his
The
comedy.
base. Yeah.
So
He
he's
just
like,
one just put
right.
out.
Right. He's like, yeah, but he said, so we'd been calling it the vid for a while.
Mhm.
And so, or the Rona, it depended
Mhm.
on our mood. And so he's like, Donald Trump has the vid of the Rona, whatever it was. And I was like, oh, great. And I look at my phone and there's a request to do like a network show at like 5:30 in the morning. And it was 3 in the morning.
Whoa.
And I was like, awesome. And so then I spent the next 2 hours on Twitter, like learning about what we knew. And then I got up and I think we did television at that point from like 5:30 a.m. through midnight that night. It was our
Wow.
election day, it was like that quick.
Wow.
But because it was a lot of also in that particular circumstance, they were asking doctors to fill in the pieces of a situation that felt so odd because every piece of advice we were giving to patients was not what was being done in the White House.
Right. Right.
And so they asked us to justify what they were doing. I mean, as simple as we now spend all day telling people who are exposed to quarantine. Yet starting in September, when this surge in the White House really started, nobody who was exposed was quarantining. Like we would see them like get like spit on or licked or kissed or hugged or whatever it was, but from
Shake
somebody that was
hands, go to
positive.
different meetings.
Yeah.
Right. Hmm.
Like unmasked, close proximity, anything that any of us would qualify as a close exposure. And they weren't quarantining and not wearing masks. And then they were turning positive. And it completely undermined. I mean, I personally believe that from like the Rose Garden on was when we lost this war. Because
Really?
it was
Okay.
because if you think about look at how the numbers head out, right?
Mm.
You had the April and May or March and April where we just got, kind of caught by surprise and everyone shut down. And we really did get the virus under control from policy. Then in the summer, we saw bad policy take hold. Places opened up. They didn't have mask mandates. That was bad local governance, is really what happened over the summer. Places that had, in my opinion, responsible local governance didn't see those surges. Places that had irresponsible local governance, places like Georgia, Florida,
Florida. Yeah.
Arizona, started to really see those surges. Texas was like okay, and then it wasn't okay. And then the more rural areas with not great local governance, like what happened at Sturgis in South Dakota, that like lit the fire up all the Midwest, straight up the Dakotas, right? But then in September, you now have the federal government basically laughing in the face of public health and saying, we are not going to follow any of the guidelines to keep this virus at bay. And what I think happened is everybody stopped listening to us.
Mm.
Because
Okay.
when you think about how this virus started taking hold, you realize that the only way this level of community spread happens is if people don't stop it.
A blatant
And so
disregard for precautions.
even if there were restaurants closed or gyms closed or whatever, it didn't matter if you're having a backyard barbecue. And that's what we were watching. We were watching them have the Rose Garden event with no masks, and then all those exposed people not quarantining. Then all the rallies that happened, like we're forgetting. But like there were seated and look, and the protests in June, ironically, did not cause a bump in cases. We
That's
know
what I
that
want to know.
because
So it didn't
no,
really.
because the way I describe it is this. First of all, the rallies were kind of like movement oriented massed events outside. Like, I mean, if you think about not the rallies, I'm sorry, the protests. If you think about the protests, it was a bunch of people walking. I wish they weren't chanting. Signs are good enough sometimes, but moving in space in one direction forward. And the rallies were unmasked in airport hangars somewhere outside, but they were, much more concentrated, stagnant air, stagnant people. And there were so many of them. And a lot of times they were a different vulnerable population. It was older people in rural America maybe didn't have access to, the same number of care providers as we do in New York City. And I think that between the rallies, the fact that people stopped quarantining after exposure, and this concept that testing discovers cases that you wouldn't otherwise need to know about, all that messaging and then no mask, guidance, you put all that together. And no matter where you live, even in New York, like we live now, you know, New York, our dam could only hold so long.
Let's
And
let's let's talk about that. Like,
Mhm.
talk to me about what it was like when you heard about the Rona, on on a cruise ship, or you heard about it on cruise ships, or you hear about it in Asia, to like when you start seeing it in your ER, and then all of a sudden you're like, oh snap, like this is no joke. Did that occur, first of all, and what was that like?
So I am not an alarmist by
Okay.
nature. I'm just that's not my personality. So I remember that one of my friends from college, who's kind of an alarmist, uh, texted me, and I was like the end of the campaign in January, maybe, and I was in Iowa, or I was in Nevada, whatever, something towards the end of the primary season. And my phone blows up, and she's like, "I'm going to buy toilet paper," and I'm like, "You're crazy." And she's like, "No, no, no, I'm locking down. Should I pull my kids from school?" And she lives in a more rural area. And I was like, "That's nuts. We'll be fine. Like, we've had viruses before. We're going to do this. It's not going to be a big deal." And I was watching this concentrated a little bit, but who can trust what's in China? We didn't know what the truth was. And then it got to Italy. And once it got to Italy and the doctors on the ground told us what was happening, I started getting more nervous. But again, it started on the West Coast.
Right.
And so for us in New York, we're like, okay, we'll have time to like figure it out. We'll get our resources. Our government will help stop this, like we will really kind of keep
Things that you normally are like the default, they got our
right.
back. Yeah.
We'll get things in place. We'll understand how to handle this. Like it's still like a controllable thing. And a week later, I was in Wisconsin giving grand rounds, and our telemedicine like practice at the hospital started blowing up with cases. And because the patients were still at home, but they were starting to call us in for shortness of breath and fever and cough and stuff. And I was with a few people in Wisconsin and then back in New York. And I was like, guys, this is not the same. Like all of a sudden, everything was changing. I was like, kind of protect your grandma, wash your hands,
Mhm.
let's stay home. Let's see what this is going to be like. And I called it background noise. Basically, I was like, you know how like you like it's like a kettle, and the pressure inside was raising, and finally the lid was going to blow off.
Mm.
And that's what we saw. And just as the lid was blowing off in March was when I got sick.
Mm. Okay.
And I didn't know I was sick because I was so tired from, kind of that many days in a row. I didn't process that the fatigue and muscle aches I was feeling were the same as I was telling patients they
Right.
had. I was like, oh, I'm really out of shape. I'm working too hard. I must be really like, I'm pathetic. I can't work this hard. I can't do this many shifts in a row anymore. I used to be a rock star.
Mhm.
And then I got
Alongside
tested.
the other things that you do also. So
Right. So then I tested myself. I got tested. I scheduled a telemedicine visit, and that was when testing was really hard to come by. But I was able to convince somebody to test me because I have a transplant child and I really needed to know. And I realized then the human toll in not knowing if you have it, which I think has been underappreciated from the beginning of the pandemic. And I'll tell you that when you see, and did you have a diagnosis or you just found out you have antibodies?
so so the way how it happened is I got sick. I had like these crazy myalgias. It just felt like the worst flu I ever had. Then my wife went off and worked, right? And I was like, I'm okay. I just got a cold. My wife went off and wasn't feeling right. And then right before she saw a patient, she said, let me get tested. And then they said that her test was positive. And then afterwards I went and got tested. So
Right. So it's a bit of a Trojan horse because you don't really know. It's not until you get really sick, you're not so sure all the time. And I think that's hard, which is why this idea of testing frequently is really important because we want everyone with symptoms to get tested, which means we have to have the availability. I remember when I saw that I was positive. I mean, so you found out you were positive after the brunt of your disease is over.
mhm.
So I found out I was positive just at like the earlyish part of my disease. Um, and that's scary because you don't know what the course is going to look like. And we were counting days, and I was waking up every morning making sure I could still breathe and that I wasn't converting to one of the ones that was going to need to go to the hospital
Mhm.
for oxygen or worse, an intubation. And it is scary, but at the same time I knew the whole time that I was fortunate than most. My kids were out of the house. I wasn't worried about infecting anyone else. I have a good sized house where my husband could use a different bathroom than me. And so that was our journey. And then from there, this all happened, which is basically the opportunity to educate people. And my lane here is not as much about, you know, talking about the mRNA vaccine or some of the treatments or the antibody. You know, it's much more about what does it look like to live in this world?
Right.
How do you make decisions for your family? How do you make decisions to keep yourself safe? What does it mean to be presented with a new medication or the vaccine? Like, to me, these are the human experiences and what that means for disease spread. Again, there are major medical consequences of these decisions that everyone is making. And the idea that each individual is supposed to know enough to make a responsible medical or medically oriented choice with all this new information. I have a headache every day. I imagine what regular people feel like.
Do you think that when you go on TV, or whether it's on Yahoo or MSNBC or whatever channel you're on, do you think that you get the opportunity to really express that?
It depends on the format. You know, some of the networks are harder because they're so quick. And they
That's what I was
do,
alluding to. Yeah.
right. And they want to talk about the news of the day, which is important, right? But it's not, you can't really get deep. Some of the shows are great because they do like viewer questions,
Mm.
and those are awesome because it really does give you a chance to kind of find out what people want to know. And around school, like I did a series with Craig Melvin on MSNBC over the summer that was basically Memorial Day to Labor Day, where we just answered viewer questions every Monday about school.
I would follow you on that
that
one. Yeah.
that was cool.
Mhm.
Um, a lot of the other networks, or I should say, the other formats. So if you're doing straight up cable news, it's quick. If you're doing some of the digital streaming networks that are adjacent, then you can probably get twice as much time and a little bit more conversation going. I'm trying to do more local news now, also, because every community is going to make different decisions as this vaccine rolls out, and I think that that's important. And then there are the Facebook Lives and other Instagram Lives that are a little bit more helpful, but they're harder to capture people's attention in the moment. But all these formats have a purpose, and there's so many of them. As long as you are constantly educating people and meeting them where they are, you're doing the best you can.
Looking back now, obviously we're in a second surge now, but being able to look back, like, do you think like we are being represented right in terms of how the news and social media, how physicians are able to like get their voice out? Do you think we're doing a good job, or could we do things better?
As doctors,
Yeah.
so it's so interesting. I think that the the landscape that this pandemic came of age in was an anti-science, anti-expert, establishment one, and that created this very odd opening for people like us to get out there and really be like available and fill the void of expert opinion. And I think that was really useful. I also think that it did something that we've seen before in disruptive communication, which is that we had more diverse voices actually out there because we were the ones like making ourselves available and helping craft the narrative. So as opposed to like institutional voices, whether it's in politics or policy or traditional media, that were always there, right? Every network didn't only have on their medical correspondent who's been there for 20 years.
Right.
They
That's what I was about
had
to. Yeah.
they
Yeah. No.
had uh, they had the on the ground doctors from all these communities,
Right.
and if we were smart enough, which we were able to find physicians of, black and brown physicians, rural physicians, academic physicians, community physicians, intensivists, but also primary care doctors or family practice doctors, like making sure that nurses, respiratory therapists, EMTs. So there's been so many voices, I think, that have been out there talking about this experience that would not normally have gotten a platform. As we transition to the next administration and the as we transition to the next administration, and there are more expert opinions being offered from the federal government that are appropriate, that are available and honest and able to answer questions. I wonder how that's going to settle out. um, but I also think that we all need a break. And I'm looking forward to an administration that can take care of the job as opposed to us having to fill in the gaps.
So, with that being said, so you are now like, because let's talk about the things that you're all involved in. Like, there's the clinical aspect of what you're doing, there's the teaching aspect of what you're doing, there's Fem and M that you're working on, there's the medical correspondence that you're doing. Are you at a point now, because I mean we can talk freely now, like is there a point where you're finding more passion doing one thing versus the other, like maybe being on TV or working on conferences, or I don't know, what are you finding like this is going to be my legacy, this is what I want to be known for? Be honest,
I
come on
have
now.
no, I mean, this is a big inflection point for me personally because I don't know the answer to that. I think that what I had been doing for the past, I don't know, I've been a doctor since I graduated medical school in 2003. So it's almost 20 years, which is crazy.
Crazy, right? Yeah.
I know, right? So it's 17 years. Um, I do not see hospital administration and even formal medical student or education being the thing I do for the next 5 years. I think that and Feminem is going to be an interesting decision because there are other people that I think are better suited to run Feminem than me in the near term because of the different directions that I'm being pulled in and the ability to focus on the innovations that women in medicine need to keep themselves, sane and working and connected. Just because I have uh, pivoted away from a project doesn't make that project less important. It just makes it less important for me, if that makes any sense.
I understand.
So it's important that I make sure that all of the other things that I've done are left in good hands.
Mhm.
And that is part of what I'm figuring out. But I think that my next step will be to do something that is public facing slash out of just basically the medical translation of policy and politics
Understood.
and what that means for people's lives as we get to the other end of this pandemic, but also address the issues that were either uncovered in this pandemic or existed before this pandemic. So we have an opportunity to make a difference on the access for all communities, but specifically vulnerable communities around healthcare, primary care access, preventative care access. What are we doing about the Affordable Care Act and health insurance in America? What are we doing about the, 30 million Americans who lost their health insurance through this pandemic because
Because they
of the
lost their
fact that they
jobs.
lost their primary employment? Exactly.
Yeah.
So there will be an enormous amount of work to be done. I'm not a policy person, but I am kind of like the interface of policy people and politics, if that makes sense.
You
And
understand
so,
both. You
yeah, I
understand
kind
both
of
and you can
like,
go in the middle.
yeah, and I could kind of remind regular people why this is important to care about, and give back to the people that do write the policy what's working and what's not working, and color that with the clinical experience that we've had over the past year, which has been extraordinary. And ironically, I have worked more clinically in the last year than I did for the couple of years before that, and I love being a doctor, actually.
Mhm.
um I just need to figure out how to do that safely, consistently, while doing all these other things. So stay
And,
tuned.
now I appreciate you answering it like that, because I think a lot of times you can see people from afar. You're like, man, this person has so many different talents. And sometimes I even have to say, I'm like, man, I wonder if they were able to do like what you're saying, policy or, whatever side project that they're doing, if they can do that 100% of the time or close to it, how much more of an effect would they have and stuff. And sometimes I think we get caught in, like, we still want to be a doctor. We still love what we do. Can we do both? And it's this tough interplay, but I appreciate your honest answer on that. So
Yeah,
uh,
we'll see. I mean, I am curious. The next 6 months is going to be interesting.
now, what are your thoughts on like med Twitter? Good, bad? Should we use it more? What are your thoughts on that?
I mean, I think that Med Twitter has been game changing in the pandemic. I think that it's extraordinary because it really does help us uh, hear from each other if we're not in the same space. I think that it's also been really important to keep ourselves connected because of the experiences we've had over the past year. I use it for education. My Twitter, I mean, has like two arms, right? It's politics and medicine, and they interface a lot now.
Mm.
But that's what they looked like before the pandemic. And I find Twitter to be I mean, it's a black hole in a lot of
Oh my
ways.
goodness, yo. All the
But
retweets and the threads. It's crazy.
but I love it. I
Mhm.
know it's like some of it may be the addictive personality, but I mean, you have to figure out like who's real and who's not. But
Mm.
everyone I follow and everyone I kind of discuss things with, like I basically know in real life now. Um, And it's kind of cool because it keeps you connected to people you otherwise would never have met or been connected to.
You mentioned that, for example, with Feminem, you feel like there's someone else who can run it better than you, just because your mind is not on it as fully as it should be, right? So there's
Mhm.
someone else who's more talented who can do that. Is there anybody on Twitter that we should be paying attention to who's younger than us, who has we're the same age, who has a different perspective that we should be paying attention to, that you would pay attention to? Who's that?
That's a good question. I would say that off the top of my head, I couldn't tell you. I mean, I spent a lot of time on Twitter, kind of with the squad that I live with, and
The
within
em
that,
squad,
it's
the em squad.
yeah, and
Mhm.
there's we let some surgeons in, and every so often, but a couple of OBs, maybe some family practice doctors. Um, and I think that there are a lot of voices. Like Cleavon is younger than me, right? And
Mhm.
he just graduated from residency, and his Twitter feed has been transformative over this pandemic. Um, I think that there's a lot of voices out there, women, young people who are talking a lot about what they're facing. The reality is that the issues that younger physicians are facing and tweeting about are less relevant to the work I do every day. So it's harder for me because we're all living in different
Yeah.
spaces. And so there are some extraordinary voices out there, and I would just kind of dance around and look at what I retweet, look at what Esther retweets or Megan retweets or Uche retweets,
Mhm.
and see whose voices, like Rhea Boyd. I just don't know if these people are younger than me. I just know they're awesome.
Mhm.
Rhea is amazing. I
Yeah.
think she's probably younger than us, but I guess there are so many that speak with such authority that I assume that everybody is 40 years old.
Mhm. That's a good point. Good point. Good point. The thing also that I'm really interested for you to answer is there are a lot of people right now who they want to be where you're at, right? And they want to have a voice that is carrying some type of influence, whether they want to do it through social media or they want to do it on TV. But at the same time, it's tough to balance clinical work and so forth. Like, I know there's no such thing as quote unquote balance. We just figure it out and make it go from there. But what is your advice for people who are like that, who are just like, I'm young, I'm trying to figure this out, but I want to talk to people. I want my word to have influence. What do you say to them?
Well, I think the first thing is that you need to your influence needs to have a purpose.
Mhm.
So I think I was actually, somebody asked me last night. I was talking to them about COVID testing, and I was doing a Facebook Live, and she asked me about my Instagram profile, and I said I don't really, like, I have it, but I don't really post on Instagram because I don't view myself as a brand,
Mhm.
right? I view myself as a doctor who has stuff to talk about, right? And I mean that honestly. And I don't mean that you shouldn't have a sense of what you're putting out there as a theme and have it be consistent, but I worry about people that want to have influence and not for the impact of what they're trying to say
Mhm.
sometimes.
It's a good point.
And so I want to make sure that everyone that wants to make sure their voice has a platform remembers that it's about the impact of your words, not your voice. And I mean that honestly, because one of the worst reasons to try to be public is for the public, the fame, right? And I
Mhm.
don't mean that the word fame is weird, but like, the excitement of being public.
Mhm.
It is exciting to like have people be like, oh, I saw you on TV, or know that if you put something out on Twitter that you think is important, 100,000 people will like or retweet it, right? That's a big deal. That makes you feel like what you've done matters. But that should never take priority over what you're trying to get across. What is the impact you're trying to give? I'll do a Facebook Live with 15 people, and you don't know how many watch it afterwards. But if those 15 people know how to live their life differently, then that's worth it to me. And so I would say to somebody who's younger who wants to increase their platform, to find something that you feel passionate about, be consistent and authentic, and then see if it meets the moment. There are going to be a lot of people who have a a desire to have a topic be listened to or have their
Mhm.
voices heard, that it doesn't meet the moment right now. There has to be an appetite for what you're selling, in a marketplace. And even if there's no money involved, the digital streaming and the social media is a marketplace of ideas, and we've seen it be good and bad, right? Clickbait happens because they know what will catch, and that's why they put it out there. And that's the part that I would make sure people don't do. It gets me sad when I see physicians build a brand around like what they think is popular,
Mhm.
but isn't necessarily going to change the
Doesn't
world
have
for the
impact.
better,
Yeah, no
you know?
impact. Right.
And so I think that we are probably one of the last trusted advisors, and we need to take that responsibility seriously.
Boom. There it is. Listen, Dr. Dara, thank you so much for your time. This is really dope. I know you're busy and stuff. So the reason why I wanted to talk to you about this stuff is because I see everything that you're saying has a purpose. But also at the same time, I see that what you have to say has an impact. And I think that's what I've been trying to get across on my show is that, we got to have a purpose. We got to feel strongly about that. But the other thing too that I'm really interested in is I'm wondering what it would be like to have like literally a 24-hour like doctor run news channel or a doctor run like YouTube channel where we control, how things are done, how questions are asked and so forth. Talk about disruption, you know what I'm saying?
Yeah,
So
but I also think that people wouldn't watch it.
you think it'd be boring?
I think that we need to also realize that what we have to say a lot of times is redundant, depressing, uh,
Right.
you know, and I mean that, and that's why when I talk about these short hits on TV, that they're like not always what I want to say, but they are what people will listen to, and that's why there are producers because they know what people will listen to, and so you have to do all of it, right? And so I think what I want is this 24-hour vaccination network where everyone is just watching different people get vaccinated, and we're updating people with the
Like on C-SPAN or
process
something.
like on C-SPAN, right? We just
Right.
get a Capitol building and we just run it put two super freezers in it and just have people come in and get vaccinated. Because I think that I agree with you that we need more. And I do think we need more physician voices in politics. I think we don't need more physician voices in media with purpose, not just reacting to what's popular. Um, and we're getting there. But I will say the last thing I will say is it is critically important that the minute you have a platform, you start looking around at who you have to lift up as well. And so I will always have access to rooms that somebody else may not have. And it may be because I am able bodied. It may be because I am white. It may be because I am from New York. It may be because I'm pushy. It may be because who knows. But as soon as I get in that room or at that table, I need to look around and see who's missing.
Mm.
And then I need to start lifting up the voices that need to be there. And if I'm not willing to do that, then I don't think I deserve to be at that table in the first place. And so I want everyone who's looking around at their ability to gain access and a platform to do it with that perspective that the first person that gets in should be continuing to open the door for everybody else.
Boom, there it is. I spoke with Dr. Cedric Dark. He said that that's the reason, that's
Oh,
how he got on TV was through you. So definitely, some evidence of what you're saying is you're speaking and talking in your truth. So,
yeah, that's what I do.
well, Dr. Dara, thank you so much for your time. I'd love to do this again with you, but I know you're
I'm
busy.
around. Just call
All
me.
right. Awesome.
Okay. Talk to you.
I love it.
Bye.